Hi folks, in this video I'm going to share my thoughts on a fairly minimalist first aid kit, which I've got in front of me here for through hiking. Now this will be part of a series of gear list videos for 2023 covering all of my planned gear choices. Now before anyone asks in the comments, I haven't been practicing first aid on myself or anything like that. I just had a surgery on this wrist a few weeks ago, so that's why I'm wrapped up like this. So I'm just in the process of reviewing and restocking my hiking gear, ready for hopefully some planned through hikes in 2023. And I thought I would try and put together a series of videos detailing what I plan to carry and my thought process for choosing the items that I've chosen so far, at least. Now I'm planning to carry a fairly minimalist kit, ultralight as much as possible, and in addition to sharing my ideas, which hopefully will be different enough to what you've seen elsewhere to make this a worthwhile video, but I'd also be keen to get any of your feedback or comments, for example with the first aid stuff, things that you think are important to carry that I might have missed, or maybe things that are potentially redundant. So the other reason for doing this video is just to get everything on record as well. So every time I come back to review my gear, I forget, it's usually so long I forget why I made particular choices. So it's good to have all of this stuff on record just for my own purposes. So I'll go through the items that I'm planning on putting in my ultralight first aid kit, which I have in front of me here. So people probably look at all this stuff and think, oh, he's carrying too much. But actually my the first aid kit itself is really just the items that I've got directly in front of me here, sitting on top of this black plastic sheet. And I'll go through each of those. What I've got down the other side here is some items that I would consider supplemental, so things that I'm carrying anyway in the rest of my kit that could be used for particular purposes. So as I go through, I'll refer to both, but just be aware for anyone in the comments that the first aid kit is actually going to be quite small. It'll fit into that little packet there. And yes, I know I could just use one of these plastic bags, but I have had those fail on me, and I also quite like having the first aid kit clearly identified. So not just for me, but also for anybody who perhaps might have to go into my pack and grab the first aid kit, having it clearly identified I think is really important. And this is a DCF bag made by Treadlight Gear in the UK, and it's quite light. Obviously not as light as a Ziploc bag, but still pretty light, and it's not going to rip or anything like that. It'll last quite a long time. So as part of this process, what I've been trying to do is look at all of the gear I carry, and also reviewing other YouTube videos. And I've put a number of links in the comments, or I will put a number of links in the comments to a range of different resources that'll give you maybe a bit of a diversity of opinions about what sort of equipment to carry for ultralight and also just for general hiking. So please have a look at those. Those are the resources that I've used, and as well as the training and that I've had in the past. Now the purpose of doing that was just to identify if there's any redundancy in my system. So there's things that I carry elsewhere which would supplement or replace what's in the first aid kit. So in other words, I don't need to include them, or maybe just identify things that I've missed. Okay, so things that are important that I should have included in the first aid kit. I'm pretty happy with what I've got here, but there's always the opportunity to improve. I want to be as ultralight as possible. However, I also want to be adequately prepared if a problem occurs. Now, an important point to make, I think, is that for most of us, serious first aid scenarios are extremely rare. I've probably only had to deal with a couple of them. And unless you're a first responder or other emergency service professional, it's extremely difficult to develop a good sort of understanding of the probability and severity of different scenarios and prepare accordingly. So therefore, what goes into a first aid kit is quite speculative for most of us, and I would include myself in that. What we include in the kit is going to depend a lot on the environment that we find ourselves in, or the circumstances, whether we're travelling as a large group, individually, and so forth. So what I've got here is just what I think will work for me, but your decisions, what you carry, are potentially going to be quite different. So just an important disclaimer I'd like to make at this point. I've been doing first aid training regularly since I was in high school, and I've remained current in first aid, CPR and advanced resuscitation for work. So every year I have to update some of those qualifications and remain current. Part of my role involves reviewing and approving fieldwork proposals, making policies, providing advice on risk assessment and management for marine-based work. However, I'm not a medical professional or medically trained beyond what all of us would get through a regular senior first aid course. I'm also not an expert on wilderness first aid specifically, although I have done wilderness first aid training. I don't have a current wilderness first aid qualification, although that's something I'd like to do again. So the items that we're going to discuss here are just things that I feel are appropriate for me to carry, given the level of knowledge that I have and skill. And again, you might come to different conclusions based on your own knowledge, experience and training and the different environments in which you hike. So if you haven't already, I would encourage you to seek professional training and advice in wilderness first aid and preparedness, and not just rely on what I or other people say on various YouTube channels. I've added a few links, as I've mentioned, to YouTube content in the description that may lead to further useful resources. The other thing I wanted to mention is that even with regular training, advice can change and new techniques or different equipment can develop. I've seen a lot of changes personally in first aid. I mean, when I started off, I think we had the ABCs, and now we have the doctor's ABCDs for our initial assessments. So that and many other things have changed. So it's important to get regular training and updates to stay current. I mean, personally, I find I forget stuff quite quickly, and that those refresher courses are extremely useful just to bring you back up to speed, even if it's only for a short while. So with all that in mind, I thought the best way to approach this was to first run through the doctor's ABCD of first aid, so that initial assessment of a casualty, and see what resources I had at each stage to assist with that process. I'll then go through some other items to deal with common first aid scenarios, with consideration of sort of probability and severity, which I think you always need to take into account. For example, I do a lot of diving, and I always carry a major trauma kit when I go diving, because even though things like shark attack or people being injured by the props of boats are extremely unlikely, the severity is quite high. So you kind of balance those two things, how likely something is to occur and how severe the consequences are. So with a high severity, you might want to include some sort of equipment to help you deal with those eventualities. And again, things that are very probable, you would want to include some resources to help with those. So for example, for backpacking, blisters. Pretty common thing to happen. So you want to have some resources in there to help deal with blisters. Just as a final note before we get started, personally I tend to prioritise severe or life-threatening injuries over minor ailments. So this is why I'm less inclined to carry things like band-aids and more inclined to carry maybe a hemostatic dressing, okay, which would help deal with a more major trauma or bleeding. That's not to say that band-aids and that aren't useful, but if I was making a choice, I would prioritise the things that are potentially more life-threatening. Okay, so I've just changed the camera around a little bit, and the audio will probably change just so that you can see things a little bit easier. Now, as I said, I'll start off with the doctor's ABCD, and we'll start off with danger. So I've got my notes here just to keep me on track. Now, there's not much I can really carry with danger in particular, because you're making an assessment of the risks to you, to bystanders, to the casualty. You're looking at the environment, a whole range of things. However, gloves I think could be included under danger because the risk of bloodborne diseases and so forth. So I've got three nitrile gloves there. These could also potentially be used if you snip off one of the fingers to help with rescue breaths and things like that if you choose to use them. So I've got those. I've also got sunglasses, which I'll carry with me, so I don't need to carry anything special to protect my eyes. I can just use my sunglasses. And being still COVID era, most people probably have some sort of face mask as well, so either a cloth one or just a normal face mask. So those are all things that will protect you from body fluids. You could also consider the information that you gather from phones or maps as useful for potentially identifying hazards in the immediate surrounds, I guess. And the other thing under danger, which sometimes has been highlighted in my first aid courses, is if there is really severe, life-threatening bleeding on a casualty, that might be something that you would identify under danger and have to deal with. But I'll talk about bleeding and that a little bit later. But that's just something to flag at this point. If you see somebody's had their leg cut off or something like that, or been bitten by a bear or a shark or whatever, then potentially if you muck around too much, they might not survive very long without some sort of intervention. So after danger comes response. So trying to get some response from the casualty, determining their level of consciousness and so forth. Now again, I couldn't really think of anything particular here for response. I'm not sure if others can. Please comment in the comment section if you can. But I did think that maybe having a piece of paper and a pencil could be useful at this stage. If you do have a conscious casualty, you could perhaps record their name or the time that you found them. Any of that sort of information could be useful. Probably you do that a little bit later after you've done the rest of the initial assessment, but yeah, that was all I could really think of there. Obviously, you don't want to delay working through the rest of the assessment to write copious notes, because there could be something really serious that you don't pick up on or you don't pick up on early enough. After response comes S for send for help, and this is where your phone might come in. Okay, this is one of my older phones, but that might be useful, or maybe a Garmin InReach. So I always carry one of these when I'm hiking. I think they're brilliant. You can communicate anywhere. You don't have to have mobile coverage. So either of those could be useful. Now you might be the one sending for help, or if there's someone else there, maybe another hiker or a bystander, then you might send them for help. Particularly if you're in a mobile area or close to, they might go somewhere where they get some coverage. If that was the case, your pencil and paper might come in handy again, just to give them some key information to pass on to emergency services, or for them to record information that they're given, the instructions and so forth. Other than that, I did think that perhaps you might need to attract attention. Obviously other hikers are going to be a useful resource, particularly if they have first aid skills, or even if they can just go for help. So, you might need to signal people. So, for example, I've got a whistle on my backpack and a torch if it's dark. So you could use that for signaling. So all of that stuff could be useful. So under-sending for help, that's what I came up with. Next, let's go on to airway. So if you're going to manage somebody's airway. Now, again, this is probably going to be a manual process that you undertake yourself, to check their airway and make sure they have a clear, unobstructed airway. However, again, the gloves are going to be useful, particularly if you've got a clear material out of the mouth so that they can breathe effectively. Or if you're going to handle the patient, having gloves on is useful, and the other protective items. Now, there are other things which I've seen suggested, and I'm not going to recommend people do or don't do this, but in terms of having a effective airway, for my car kit, I have a large separate kit which includes things like oxygen regulators, oxygen cylinder, suction devices to clear airways. I've got artificial airways and so forth. I haven't included anything like that, certainly not the bigger items, but I haven't included any artificial airways here. I have seen it suggested that you could add I think it's called a nasal pharyngeal airway. Anyway, it's a nasal airway, basically a tube that goes in through the nose. The ones I have in my kit are actually for going in through the mouth and under the tongue. That's what I'm trained in. So I'm not so sure about putting in a nasal airway, but you could perhaps carry some tubing or something like that to make something like that to provide a clear airway. Another thing that I've heard suggested is using safety pins and some sort of line to lift the tongue forward out of the mouth, if you can't maintain an effective airway. I don't know whether I do that personally, but I suppose it would depend how serious the conditions were. If you had another person with you, they could perhaps help with jaw thrust if you can't move the patient's head, or head tilt if it's safe to do that while you continue with the rest of the assessment. Or perhaps you might be able to effectively open someone's airway and still continue with the rest of your assessment. Anyway, that's all I could come up with for airway. Obviously, the airway stuff's going to depend on the conscious state of the patient. If they're fully conscious and breathing fine and that, you might not need to worry about that. But you might just get them to keep still. But if the patient's unconscious, that's a different sort of story. Breathing. So things like the quality and the rate of breathing, respiration, and so forth. Now, there's a range of things that you might pick up on, that you may or may not be able to treat. And again, some of the things that I've seen suggested, which, I don't know whether a regular first aider will be able to do. So, for example, I've seen people suggest that you include a 14 gauge surgical catheter, which is a small device. If anyone's I had one a couple of weeks ago, inserted in here into one of my veins. It's basically a metal tube and a sleeve over the other outside that they put in, and just basically that allows them to put fluids and that into the body. But why people have suggested using those in first aid kits is for decompression of a tension pneumothorax. So that's when there's half of the chest has been, maybe there's been a severe chest injury or something like that, broken ribs and so forth, and what's happening is that there's a puncture in the lung and air's leaking out into the chest cavity, and gradually the patient will just go downhill because the chest cavity will fill with air. That's why it's called a tension pneumothorax, and eventually they won't be able to breathe at all because the good lung will be completely crushed and the heart gets pressure applied to it, and there's all sorts of problems. So that's a very serious problem, and obviously if you don't have any means of treating it, then the person will probably go downhill very quickly. I don't know personally whether I would use something like that. It's not something I've been trained in, so therefore it would be a risk. But on the other hand, you could be saving somebody's life because they might have a very short time to live if they've got that sort of problem. yeah, again, it's a tricky one. I don't have one currently. I think they'd be quite hard to come by. Regular chemists don't have them, but it's just something that I'll flag there. So they recommend 14 gauge or above surgical catheter. Some of the things that most of us would be trained for and prepare for. So using rather than a tension pneumothorax, if they have a sucking pneumothorax, so there's a hole in the chest or something like that, you can set up you can apply a plastic bag. I won't go into the first aid of it. You guys can do a course, but the sort of resources that you would need to help manage a suction pneumothorax would be things like plastic bags. Just these little Ziploc bags would be fine. It's just the plastic you need rather than the Ziploc. And maybe some tape. So I've got some KT tape here that could be used, or Leukotape, or just tenacious tape would probably work. So that's a couple of major breathing related things that you could consider. Other things under breathing, if you're trying to get the head in a good position and a clear airway, you might have to support the head and neck, something like that. So, having things like trekking poles, clothing, maybe, a sleeping pad or something like that, to help position the head and open up the airway. There could be, some of that could be useful. Next is circulation. So there's a number of things covered in circulation. The monitoring of the patient in terms of their number of heartbeats and so forth. You can check their pulse, whether it's the radial pulse or the carotid pulse. And that can give you a lot of useful information. It can give you a bit of an idea of what their blood pressure might be like. It can identify a number of, potential problems, rapid heart rate, so forth, or a very weak heart rate perhaps. So that sort of thing is important, and perhaps, resources that might help with that. Well, I always carry a watch. I always have a good basic watch that I carry with me, but you could also use the clock on your phone or the stopwatch, and use that to work out the number of beats per minute and all that sort of thing. So those could be useful resources. Some other things to consider with circulation, and I think this is going to depend a lot on what problems you diagnose when you encounter the person. I mean, obviously looking at their heart rate and their blood pressure, that can lead to a lot of information, potential things that could be wrong with them. But some things might be more obvious, like there could be major arterial bleeding, or there could be an injury to the head which is bleeding quite a lot, or there could just be really simple things like just a cut. Just a bit of a nasty cut or even a minor cut. So really a lot of things could come under the category of circulation. Some of the resources that might be useful, well, one of the things I thought of is having some scissors. So you can see I've got a little pair of Victronox scissors here in my kit, and those could be useful for making a tourniquet. So most backpacks have lots of straps and things on there, or you might carry, well, that's probably not ideal, but I think the straps would probably be better off a backpack. With a branch or something like that, you could fashion a tourniquet. So if somebody had a major bleed on a leg that you weren't, on their leg or their arm or something like that, that you weren't able to control with just pressure, then you might have to apply a tourniquet, make one and apply it. If you don't have a pair of scissors, then just a knife. I always carry a knife with me, just a little knife like that. That will also be useful for making a tourniquet. Some of the other things, obviously if you're trying to stop bleeding, having some sort of dressing that you can apply, you'll need to have your gloves on, but something like that you can use to apply pressure. Not a big bulky dressing, this is only a small one. I've got another one here to replace it. Okay, some of this is out of date, so I'm just replacing. That could be good. If it's not on a joint, or actually even whether it's on a joint or whether it's on a Whether it's on a limb or not, you could consider one of these quick clots or what they call hemostatic dressings. So the hemostatic dressings are good particularly for, like the torso and that, where you've got a major puncture wound or something like that and you want to try and arrest bleeding. You can't use a tourniquet, so that could be useful in that case. Also with those major wounds, you might need to wash them out. Now some people suggest using a syringe or carrying a syringe. I don't have one with me, but I do have these bottle tops on all of my bottles, with these sports caps or whatever they're called, which should produce quite a reasonable stream when you push water through them. And you can probably think of other things that you might carry with you that can produce a nice stream of water. One thing is maybe just putting a pinhole into one of these bags and just squeezing it really hard to get a good jet of water for cleaning out wounds. So that's wound management, but also I guess your initial cleaning them out before you try and stop the bleeding. If there's an injury to the head, which can bleed quite a lot, another thing that you might do is use super glue. So there is a method where you wrap the hairs around, if they're long enough, across a wound to sort of close the wound up, and then apply some of the super glue to actually help hold the hair in place and apply pressure to the wound. So that's for head injuries. For other types of cuts that are maybe not quite as severe, not bleeding as badly, you might use something like KT tape just to make some sort of closure. I mean, people also use those little strips that you put across. I've never found them particularly effective. They seem to come off for me. Whereas KT tape or leukotape, which is something else I carry, I usually have. KT tape is actually a pretty new thing for me. I've never tried it before, so I just thought I'd include some and just see how it went for similar purposes to what I use leukotape for. The only thing that appeals to me about this is it's actually got a backing on it, which makes it easier to use, whereas the leukotape I usually wrap it around a pencil like this. I'm actually a little bit short now because I've used quite a lot of this recently, but I just wrap it around a pencil and I just unravel it when I need it for blisters or whatever. But this is good for wound closures as well. You could put it over the wounds, and also if you want to make simple band-aids and things like that. You can see I don't have any band-aids here. Obviously that's something that people might consider. Gauze, having some gauze, like gauze dressing, again, that's a useful thing to have. And the other thing that you might consider is antiseptic wipes under this category. So I've got some iodine here, swabs, and also some alcohol swabs, so one of each, just in case you don't really want to use iodine, you want to use something not quite as harsh. Then you've got the alcohol swabs as well. So again, I'll be replacing those. Some people use Neosporin and carry Neosporin and things like that. I haven't got any at the moment. I don't know whether that's something that I would carry or not. Another thing that I carry that might be used as a disinfectant is potassium permanganate. So I actually have this in my survival kit. It's just a little tube of potassium permanganate. Another thing that people sometimes suggest, and I've got the tools for this, but I don't think I would do it personally. Some people have said, you could stitch the wounds up with, some Gorilla Tape, or if you had a sewing kit or something like that, and a needle. I carry a needle and Gorilla Tape, which is a type of floss, but it can be used like a thread for sewing, really for repairing gear and that. The needle can be used for other things as well, but I don't think I would actually stitch myself or anyone up with that. First off, I don't think I'd be particularly good at it, but the other thing is, once you've closed a wound, if there's an infection, my understanding is that, you'll end up, they'll have to sort of open it all up and you'll end up with a much nastier wound, compared to if you just left the wound open, stopped the bleeding obviously, and then left it to the professionals to do the stitching up and all that, Now the last item is defibrillation, and I don't know about you guys, but I can't see myself carrying a defibrillator on a hike. They're not super heavy. The new ones are actually quite good, but yeah, it's something that, you know, it's a significant amount of weight to carry. I do have one in my office at work that I loan out for field work, but it's mostly field work where you've got a, you know, a vessel or a vehicle. So I don't think anyone would carry a D for defibrillation, but what you might carry, or what I carry, is a couple of aspirins. So obviously it's not going to help if somebody's in, you know, respiratory arrest or anything like that, but you know, if somebody's experiencing heart problems, then aspirin is a good thing to have with you in a first aid kit. Now, recently I've seen an E at the end of Doctor's ABCD, but I'm not really sure what the E's for. It's probably something that's come in since my last first aid course. I don't know if it's for evacuation, evaluation, or what. If anyone wants to comment on that, please do. Now, what I'll do is I'll move on to general assessment and treatment of casualties and common ailments, and just talk about some of the other items that I've got here in my first aid kit and some of the other things that I might carry as a supplement to the first aid kit. So let's just run through a few of them. Just with the, I don't think that, you know, I used to carry first aid notes, but I don't really think they're that useful. Rather, I would actually have first aid instructions on my phone, because they're much more comprehensive. I've got a couple of, this is my old phone, but on my current phone, which is filming, I've got you know, a couple of really good first aid apps that just go through the Doctor's ABCD, and they go through, you know, the diagnosis of specific ailments, you know, the treatment, all of that sort of stuff. So a good phone app, I think, you know, is something that most people would have. Things for keeping a record of, you know, the casualties. So document the casualty's condition, if that changes over time, which is really important, you know, if there's a progression. So if someone's, you know, going downhill, or if they're improving, you know, having a record of things like their heart rate and breathing and all of that sort of stuff, what you do to them, so how you treat the casualty, all of that stuff's important. So I have, you know, some waterproof paper that I can make notes on, and a pencil. I have also, well, one thing I would like to do is get a proper casualty card, because remembering what to include on here is tricky. So it'd be nice if there was actually a compact casualty card, you know, that you could use for monitoring somebody, that had all of the, you know, maybe a table with all the stuff that you've got to monitor. That would be really useful. I haven't seen a lightweight version of that yet, or been able to get one. Now, some of the things that might happen, you might encounter while you're hiking. Some of the more serious ones, perhaps if there is an injury or a fall, you know, somebody could have a potential spinal injury, or they could have a broken or injured limb. So there are a number of resources that I don't have anything in my first aid kit really for dealing with that, but that's because there's so many things that you could use for stabilizing limbs, or for you know, stabilizing the neck, all that sort of stuff. So, you know, for example, you know, you might be able to make a something to go on someone's limb. I've got this, but you know, just out of a sleeping mat. Okay, so you know, that's relatively rigid. So you could use that in combination with either a bandage or you know, some clothing. You might use clothing to support the limb, so that's another thing, and that's where having these safety pins could be useful. You know, if you want to make a sling to hold somebody's arm in position, you know, then you might just use their shirt and safety pins to hold the arm in position. Another potentially life-threatening problem could be hypothermia. Okay, so you might need resources to take care of hypothermia. One thing that people often recommend is to have a garbage bag, or a couple of garbage bags in a first aid kit. Now I've got one here. I don't know whether I'd necessarily carry it or not, because I think I've probably got a lot of other stuff that would serve the same purpose. So for example, a pack liner, or this is just I think a mylar sheet for a ground sheet. There's an emergency blanket there. Okay, this is quite a good one. It's a multi-use item, so not only could you use it for first aid, but you could also create a shelter with it. You know, if you were hiking and you got into quite cold conditions, you could perhaps use it to supplement your sleep system, you know, use it as a vapor barrier or something like that. So it's a useful thing to have. I don't carry it in my first aid kit, but I do have it. I've got some line there for making a shelter, so if you wanted to keep somebody protected from the rain, you could use the mylar blanket and or just the ground sheet, or even just your tarp or something like that, and use this to create a shelter. Oh, I didn't mention I carry trekking poles, so you know, if you wanted to make a splint, you know, again for somebody who had a broken arm or some sort of injury that needed to be or a leg, you know, something like that needed to be fixed in position, you could obviously use that to help create a splint. Another item that's not in the first aid kit, but I often include, particularly for this country, Australia, is a pressure indicating bandage. So these have a little square here, or it starts off as a rectangle and then becomes a square, which indicates the amount of pressure to apply, and this is primarily for snake bites. So I've seen up to 14 snakes on an overnight hike. You know, they are around. You know, generally they keep away from you, but sometimes you encounter one which is a bit more aggressive. So I think, you know, in a country like Australia where you have quite dangerous snakes, having a bandage for pressure immobilization is really important. This could also be used for sprains, you know, and those kind of injuries, you know, for supporting your knee or your ankle, something like that. So again, that might be a reason for carrying one of those. This KT tape can also be useful for that purpose. So this can be used for, you know, improvising something around your ankle, for example, if you sprained an ankle, just to give you some support. That's part of what it's used for. And the other thing I'll just mention, now that we're up to this, is medications. So there's a range of different medication you could potentially carry. I'm just going through at the moment and working out how many tablets for each to carry and what I'm going to be carrying. But just a few things. Benadryl is one thing that's been suggested. I've actually got a different type of medication here that's available in Australia, but it's basically the same thing. It's an antihistamine. Okay, so if people get an allergic reaction, you know, whether it's just allergies or something a little bit more serious, then that could be potentially useful, some sort of antihistamine. Another thing which I don't think you'd want to go without is something like ibuprofen, which is an anti-inflammatory. Okay, I've been using these a bit lately. So ibuprofen is a useful thing to have with you. I mentioned the aspirin already. I think another important thing is something like GastroStop, which is something that's used for treating diarrhea. Okay, so I always carry some GastroStop with me because dehydration can be a major problem, and obviously there's a general discomfort of gastric problems. Beyond that, sort of my second tier, I suppose, is things like I've got here a basic paracetamol, okay, for pain relief. I've also got some water purification tablets, okay, if you're not able to purify water in other ways. And this, again, this may or may not be relevant, but I've got some travel calm, you know, particularly if you're going to be going over water, or, you know, you're traveling on a vehicle or something like that and you're prone to getting seasick, that could be useful. So those are some of the more serious things, and I'm sure other people could think of, you know, other scenarios that you might need to deal with. You know, even minor stuff like just, you know, basic cuts and stuff. I mean, you know, if you've got just a bit of iodine or a bit of alcohol and maybe some KT tape or the Leuco tape, you can use that for making up, you know, little band-aids or something like that. Or you could cut up one of the obviously not the hemostatic dressing, but, you know, just a normal dressing. You could cut that up to help make, you know, pads to cover injuries and help reduce the chance of infection. But if we move on to general maintenance, just sort of common problems that you might encounter, one thing is blisters. Now, people carry a range of different things for blister treatment. I tend to keep it fairly simple. you know, I mean, I don't tend to get a lot of blisters, but if I'm walking a lot, you know, on roads and beaches and things like that, it does happen. So I use leukotape a lot for that. Okay, if you start to get a bit of a hot or sore area, you know, it looks like you're getting a blister, you can put some of this on it. KT tape would probably serve the same purpose. Again, I'll try that out. I use these little Compeed blister treatment pads, so I don't carry the moleskin or anything like that, but I use these ones. I find they've been really good. They sort of draw out the moisture and that, I believe, in the blister. But whenever I get a blister, you know, a decent one, I'll just stick this on it and put a bit of either KT tape or the leukotape over the top, because they don't stick very well, so it's good to have a bit of tape on it, and then that pretty much sorts it, you know, and I'll just, you know, maybe have a bit of a break, but then keep walking and it seems to be fine. So yeah, blisters are a pretty common thing. Some other things to think about, maybe ticks. So I've got some tick twisters here. Now I don't know if these are the current best approach for dealing with ticks. You probably want to look into that. But this is something that was suggested for me for removing ticks, and they don't weigh anything, so I've got a couple of those. I've also got tweezers, which could be used for ticks, or they could be used for splinters or whatever. Sort of related to that, I always carry a magnifying lens, and you know, it can be used for a range of different purposes. I mean, you know, if there's really small text, you can read it. So if there's some instructions you've got to read, you know, it makes it easy for that. If there's something really small like a scrub tick or a small splinter, you know, you can get in with it with this. I mean, you can do the same thing with your phone, just use the zoom on your phone. But, you know, if the phone's not working, or, you know, batteries are low, whatever, having this I think is good. And you could also use it for making fire. So I always carry a lens like that. I've got a little needle here, which is just used for removing splinters as well. That's another thing. Toenail clippers. Now, I've heard people say that they can use these kind of scissors for cutting their toenails. I've tried. These will work on my fingers, but my toenails are just too tough for that sort of stuff. So I recently started carrying a pair of toenail clippers. They're not the lightest thing. If anyone knows of any lighter options, that would be good. I find that the fingernail clippers aren't strong enough to do my toes. Actually not even strong enough to do my fingernails. I need something a little bit tougher. So that's I've started carrying those anyway. What else? Another thing that I carry, not in my first aid kit but separately, is a mirror compass. And the mirror can be used for signaling for help, but also it can be used for checking injuries on your face. You know, like if you think you might have cut yourself on the eye or on the eyelid or on the face, something like that, you can have a look with a mirror, which obviously you can't do in the bush if you've got no other means. Maybe you could take a photo with your phone, but I find this works a lot better. Or if you've got something, you know, going on in a place where you can't get to easily, so you know, around the back end or something like that, or the back of your leg or whatever, you know, you can use this to sort of look around and just see what's going on. So I think having a mirror is really useful. And, you know, combining it with a compass I think is a good thing. I used to carry a separate signal mirror, but, you know, I think that one's just as good. So some of the other things that I personally might include, I have some sunscreen or some zinc, which I carry just generally in my pack for personal hygiene. It's not really first aid, but I'll mention it. Body Glide, or this is what's called Action Cream. It's just something basically to help with chafing. So chafing is a pretty common problem. You know, I wear the stuff I wear. Generally minimises chafing, but I still find that if it's really hot, you know, I'll still get some chafing. So I'm actually thinking of putting some of this stuff into a smaller container that will fit in my first aid kit. So I just bought that when I was travelling around recently. I've mentioned the Gorilla Tape already. Okay, I carry a medication. This is, again, another anti-inflammatory, but it's a prescription anti-inflammatory because I get a lot of neck and back problems, so I sometimes include that. Something else that you might include in the self-care is maybe one of these massage balls. You know, if you have problems with plantar fasciitis or whatever it's called, you know, or other things that other muscle massage that you want to do. Okay, that could be useful. Finally, one of the other things I include in my first aid kit, which isn't really first aid, but it's just general maintenance, you know, any sort of tapes and patches and things like that you might include. So I've got a couple of patches here for my sleeping mat. I've got some tenacious tape, which can be used for repairing different items, and little strips here of tenacious tape. I also have in my survival kit a strip of tenacious tape and some leukotape, okay, but that's separate again to my first aid kit. In the first aid kit I just have a couple of small patches, and I've got a little bit of DCF tape, depending on whether I'm carrying a DCF. Usually I have a pack or something like that that's DCF, sometimes a shelter, but if I don't have a DCF shelter then I probably don't need it, but just a small strip like that. I've also, when I take my tent, I have a slightly larger strip that stays with the tent. So that's general maintenance for your gear. I've already mentioned other things. One of these little O-rings, or they're not an O-ring, but they're a seal for the Sawyer squeeze. So if I lose the seal out of my Sawyer squeeze, I've got a spare one. It's a good thing to carry. So that's what I do carry. You know, some people probably think it's excessive, some people not. I'll try and pack this down and just sort of give you a weight and an image of how this all looks. Again, I want to emphasize that the stuff that's actually true first aid gear, that's only carried for first aid, is just what's here, okay? And some of these extra bits that are on the side are just for restocking things that are now out of date, okay? Like some of the medications and some of the dressings and that are out of date, so they've got to be thrown out, and there's new ones to replace them. So I'll pack all that up and give you a weight on it into this little bag. Some of the things that I don't carry, which some other people have suggested, are things like band-aids. And I said at the start that I tend to focus on, you know, more serious injuries. Band-aids to me don't seem to do much. I find they fall off really easily. Although my mother did actually show me some over Christmas that weren't too bad. They had a reason, but they were a little bit like leukotape. They had a much better sort of adhesive on them. So you know, if you get some good quality band-aids, then sure, include those, or you could just make something up with leukotape and maybe some of the dressing material. Triangular bandage. Again, this is something that can be improvised. You know, if you wanted to have some support for an arm, like a break or a sprain, something like that, you could improvise that with a shirt or some other clothing and just some safety pins. My daughter came around the other day and she'd actually improvised one with a swimming costume, so that was pretty good. I was really impressed with that. She's only 7 years old, so I thought she did a fantastic job, improvising a bit of a first aid item. Crepe bandages. Again, if I was going to carry a bandage or multiple bandages, I would just stick with the ones that can be used for pressure immobilization, because I think they're going to be more useful rather than carrying a whole range of other types of bandages as well. Small bottle of antiseptic cream or liquid, like betadine. I've got one here which is a triple antibiotic cream. That's something that comes up a lot, and Neosporin is another thing that people have mentioned. Yeah, I mean, that's probably a good thing to carry. I don't, mainly because I've already got the antiseptic swabs, and I've also got the capacity to make an antiseptic wash using the potassium permanganate, so I don't carry that. Small bottle of saline solution is another thing that's been suggested. Again, it could be useful for certain purposes. It's not something I carry. Wussy wipes. I've actually got some of those somewhere. They're like a little. They look like tablets, but when you put them in water, they expand. They're actually not bad. I use them as a dress, or not as a dressing, but as a pad the other day in here, a bit like a bit of a gauze pad. So yeah, they seem pretty good. You know, I probably would carry them somewhere else in my pack, you know, maybe with my sanitary items. I've talked about the antiseptic creams. EpiPens. So I think if you're in a group and or individually, and you had, you know, you knew you had problems with, you know, bee stings or whatever, you know, those kind of allergic reactions, then absolutely carry an EpiPen or a couple of EpiPens. I don't have one in my kit. A face mask or CPR mask is another thing. As I said, you could improvise it with a glove by cutting one of the fingers off, something that would at least minimise the transfer of fluids. Things are leaning a lot towards compression only CPR now, so that's another option. You know, if you don't feel you want to give somebody mouth-to-mouth resuscitation, then just compression only CPR is an option. So again, I don't carry a face shield specifically, but I can make one if I need to. Basic instruction manual, I've already said the phone apps are good instead of that. A small iPad, a small eye patch, so a dressing to go on your eye. It's not something I carry. You could probably improvise it with just a normal dressing, but again, that could be something to consider. Cotton pads and cotton tips, again, something I don't carry for cleaning wounds and so forth. Anyway, I hope that's been useful to you, and I'll finish up now. This has probably been way longer than it should have been, but hopefully it's been useful for the people who've hung on till the end. I'll pop the weights up once I've packed all of this stuff in and I've got my kit ready to go.